I'm Deanne Moore, and we're here at the annual meeting of the American Society of Plastic Surgeons. I'm joined here now by Dr. Brian Forley, a board-certified plastic surgeon in New York City who has been in practice for over 15 years. Welcome to the show.
Thank you.
Thank you so much for joining us. We really are
Pleasure.
looking forward to this. We're going to talk a little bit today about the skin discoloration. Can you talk to me about that, what you use?
Well, skin discoloration is a very common problem in the population, and it can be something that people develop because of hormonal abnormalities, something that might occur during pregnancy, for example, called melasma, and elevated levels of hormones, or it can be produced by excessive exposure to the sun, or it could be the result of procedures that they may have undergone in surgical offices, which can produce pigmentation.
So if we have these brown spots, what is something that we can do to help lessen the appearance of them or to get rid of them?
Well, there's an array of approaches that can be tried, extending from laser, intense pulse light, or IPL devices, or topical creams that can be applied to the skin. And traditionally what's been used is something called hydroquinone, which has been available for many years. However, it is an agent that can be very irritating to certain skin types. It can be something that can cause reactions. And in recent months, a new product has emerged on the market called Lumixyl. And
Lumixyl?
Yes.
Okay.
And this was developed by researchers at Stanford University. And the beauty of the product is that it's very safe, it's very effective, and it's very well tolerated by all skin types. So it can be used in a broad array of patients, and it can be used for an extended period of time, as opposed to hydroquinone products, which in some patients over periods of months can cause irritation.
So if you had it on your face or maybe on your hands, is it a lotion?
It's a cream. It comes in a pump,
okay,
and it's applied twice a day. And generally, you'll start to see results in the range of about 8 weeks with everyday use. And of course, it depends on each individual, because some people will respond more rapidly than others. And it also depends on the nature of how the problem originated, whether it was from a procedure or whether it was something that was related to an imbalance of hormones in the body. In addition, it can be used as a preventive means. For example, in some of the procedures that we do, just the inflammation from the procedure, the body's healing response can produce pigment. We call it post-inflammatory hyperpigmentation. And so if you have a course of Lumixyl used as a preventive, in other words, pre-treat the patient and then continue to treat them afterwards, then you can oftentimes either lessen or completely avoid some of those pigmentation issues.
Will the spots come back if you stop using the Lumixyl?
It really depends on the nature of how the origin of the brown spots arose in each individual. And so that would really be individually moderated or modulated depending on each patient's needs. But it can, in some cases, be used for an extended period of time safely for those who need to use it for a longer duration without causing the type of reactions or hypersensitivities that had been seen in the past with other products.
All right, thank you, Doctor. We appreciate you taking
Sure.
time to come on our show. Thanks, everyone, for joining us. I'm Deanne Moore for the Plastic Surgery Channel.